Welcome to this session of Counseling Psychology course. Today we will discuss about drama therapy. We will analyze its key concepts and learn what types of techniques drama therapy employs in an effort to heal participants. Key concepts in drama therapy. As we know that drama therapy is a group process which explores dramatic engagement between members of the group, and it is a standout process that offers an outlet for the expression of intense and diverse emotions, so that fear emotions can often be expressed with a sense of safety in the dramatic mode. This is partly because there is no real life consequence to the expression, but also because drama affords a distance or separation from what is being enacted. In this process, it has unique advantage that the actor simultaneously experiences strong emotions and being in control of her expression. Drama therapy emphasizes the interplay between emotional release and emotional containment. Containment does not imply suppression but rather mastery over one's emotion, enabling one to release strong feeling through appropriate and acceptable channels. Some people need more help with accessing and expressing feeling or achieving a greater connectedness with their emotions. Others are easily carried away by the emotions and need more help with containment or self-mastery. Such individuals need to experience emotional expression and emotional containment concurrently, until they begin to recognize and trust the level at which they can tolerate the influx and discharge of feelings. There are some key concepts that are essential in building the drama therapeutic relationship, which are transitional space. Transitional space indicates the imaginary space created in the context of drama, which displays the basic principle of trust and comfort between the client and therapist. It provides an opportunity for the client's inner problems to come out, be role played, put as an external object, observed and acted out. According to Winnicott, it is in the transitional space that the child develops the object relatedness and true self-expression. The language of transitional space is naturalistic and can be entered into through various ways. Sometimes the transitional space is described as an intermediate area of experience or in between. This space of in between is in between reality and fantasy, in between thinking and feeling, in between memory and sensation, and in between thoughts and functions of the mind. This felt sense of this inner spaciousness opens and expands beyond our body boundaries. Sometimes the transitional space is also described as potential space. In this personal state or place, there is a shift in the locatedness from being located within the mind alone into being located within the innermost field of awareness. The experience of living within transitional space provides a person with the novel experience of simply being without constant pressure of empty performance, because it provides an outlet to express their inner experiences. A person can also speak and language their inner experience within this dimension of transitional space. This speaking from within the transitional experience facilitates the process of embodiment. The very ritual of becoming aware can provide an experiential structure for the person to tolerate, hold and metabolize subjective state of experience that are painful and fearful. Boyer informs that being in the transitional space of awareness allows the clients to experience intense and painful states of experience without being totally organized and completely saturated. This space helps to create insight into the problems and new learning and coping emerges out of it. It is where the client develops capacities to face reality and engage in meaningful relationships, and client gains courage. Next is metaphors. It is observed that some clients or client groups form relationships with the dramatic symbols and metaphors quickly and spontaneously. They are able to create, be aware and use the richness of the symbol or metaphor. The formation of and expression of a symbol or metaphor within drama therapy involves a particular kind of relationship with the material presented by the client. Use of metaphors help in interpreting the emotions, thoughts and behavior differently. For example, different emotions can be symbolized through different pictures like happiness through swaying the of tree in breeze. Drama therapy enables the creation of a symbolic and metaphoric reality that clients can explore. The therapeutic potential of symbols and metaphors is connected to dramatic scenarios like stories, improvisations, object play, etc. It is through the scenario that the value of the symbol or metaphor is developed. The symbolic and metaphoric world created can have an intimate relationship to the issues they bring to the therapy. Thus, this dramatic form enables the expression and exploration of various issues in 3 stages, which are: the first stage involves discovering the world of images, both verbal and dramatic, which the client or clients use or can use. Eco calls this an encyclopedia of reference that someone draws upon in making a symbol or metaphor. For the purposes of drama therapy, it is crucial to discover whether the client can connect the images to themselves or to see whether they can make personal metaphors. The next stage involves the use of the connections made within the metaphor to explore a situation. The therapeutic effect of the metaphor lay in the way it is permitted the release and expression of feelings which were repressed and censored within usual communication. As an alternative mode of relating to and describing an experience, the dramatic metaphor enabled release and change to occur. The final stage involved the connection of the metaphoric exploration to the real life situation. Next is concrete embodiment. Drama therapy also helps people feel embodied because it involves being present in one's body in the moment, like yoga, dance and other physical activities. The act of drama has the ability to help people be more attuned to their bodies and to focus on the present moments as opposed to the past or future. In theatre, the body expresses an actor's imaginations and helps actors to discover and express their imaginary ideas. The actor discovers and expresses roles, ideas and relationships through face, hands, movement, voice, that is the body. In drama therapy, the dramatizing of the body is of similar importance. This concerns the way in which an individual relates to their body and develops through their body when involved in dramatic activities within drama therapy. Embodiment in drama therapy involves the way the self is realized by and through the body. It is a technique that transforms the abstract into a physical form using the client's body. The body is often described as the primary means by which communication occurs between self and other. According to Elam, this is through gestures, expression and voice. Attention is given to the ways in which the body communicates on an unconscious as well as conscious level. The way the body relates to an individual's identity is then an important element in drama therapy work. On a general level, the embodiment concerns the way a client physically expresses and encounters material in the here and now of a dramatic presentation. It involves unlearning old, ineffective or faulty behaviors and experiencing new effective healthy behaviors. This participation results in a deepened encountering of the material the client brings to therapy. Hence, the use of the body in drama therapy is crucial to the intensity and nature of a client's involvement. As specified by Jones, there are specific ways in which this process relates to change drama therapy. The first area involves clients in developing the potential of their own body. Here the body is focused upon in terms of dramatic skill. Dramatic works aims to aid the client to inhabit or use their body more effectively. This might, for example, concern communicating with others more efficiently. The second area has its main focus the therapeutic potentials and benefits of the client taking on a different identity with the drama therapy. Within this area, the self is transformed by taking on a different bodily identity. This transformation can result in insight, new perspective and release which can bring about changes in the client's life outside the created identity. For example, the client might grant themselves new permissions in terms of their relationships to their body. The third area concerns work that explores the personal, social and political forces, influences which affect the body. Here, drama therapy offers the opportunity to work on areas such as body image or emotional traumas related to the body. Courtney has stressed the importance of the connection between the body, action, change and drama. He argues that in a drama, the body plays a particular role in the way we know ourselves and respond to the world. When an individual is involved in drama, knowledge is gained primarily by and through the body in action. By physically participating in a dramatic activity, the body and mind are engaged together in discovery. Issues are encountered and realized through physical embodiment, that is, they are made and encountered through the body. In drama therapy, this physicalized knowing and being within a dramatic representation of a problem or issues make a crucial difference to the verbal recounting or description of a client's material. Next concept is dramatic projection. In drama therapy, the individuals can take on a fictional character or a role, play with small objects, create scenery or enact myths. As this happens, they project aspects of themselves into the dramatic material. A theatre in miniature is created within the group and within the self. The classic Freudian position sees process such as projection and identification as primary defensive. For drama therapy, though, the importance lies in the way in which this phenomenon of dramatic projection creates a vital relationship between inner emotional states and external forms and presences. As per Jones, dramatic forms and process, whether playing with objects or playing roles, connect outer expression in drama with inwardly held feelings or life experiences. Dramatic projection within drama therapy is the process by which clients project aspects of themselves or their experience into theatrical or dramatic material or into enactment and thereby externalize inner conflicts. Dramatic projection enables access to dramatic process as a means to explore the client's unconscious material. The dramatic expression creates a new representation of the client's material. The projection enables a dramatic dialogue to take place between the client's internally held situation or material and the external expression of that situation or material. They use metaphors and props for enacting out the inner feelings and issues. A relationship between the inner state of the client and the external dramatic form is established and developed through actions. Thus, the dramatic expression enables change through the creation of perspective along with the opportunity for exploration and insight through the enactment of the projected material. So, these are some basic concepts that are integral part of drama therapy and make it unique and effective. Now, we will discuss various techniques employed by drama therapy. There are a variety of techniques that are used which has roots in theatre as well as therapy. For example, psychodrama, sociodrama, playback theatre, role play, theatre of the oppressed, therapeutic spiral model, etc. The techniques vary with regard to the following aspects. The first aspect is being informal or involve a formal presentation. The second aspect is having a script or without any script. Clients take on an external character's role or acts out his or her life directly. A few of the techniques of drama therapy are as following: stimulating creativity and spontaneity, In drama therapy, the therapist usually aims to encourage and promote the participants to develop their creative nature and be spontaneous in their participation. According to Emunwa, the establishment of a creative, playful environment is necessary so that there is no pressure on the clients to perform. This gives them an opportunity to respond more adequately in a given moment to life events without inhibition. Steven describes that this can be done by continuously placing group members in situations which demand a response and by providing the chance for them to try out a range of alternatives with the help of the therapist and the group. Indeed, the level of activity, creativity and spontaneity in all the group members is crucially related to the final quality and success of a session. It is intended towards the elevation of the problem presented, thus aiming towards a constructive result. Second technique is role playing. According to Landy, drama therapy begins with the premise that human beings take on and play out roles as a natural means of expression. The client in drama therapy has a variety of expressive forms to choose from to represent the material they are bringing to therapy. Role playing refers to process such as someone playing themselves or an imaginary character or a person taken from life experience within a role play or improvisation. The clients or participants are encouraged to enact their own self or take another person's role. Role taking and personification can enable the client to experience what it is like to be someone else or to play themselves within a dramatic representation of an aspect of their own lives. This connects to the process of understanding the other person's perspective and creating an empathy with them. It also helps in developing the way in which a client relates to others. It can also assist in the process of seeing a problematic situation from the point of view of another. The participants are also connected with their own experiences. The involvement of fictional or imaginative material through the role playing can create opportunities to transform and explore the issues in a new way. The fictional world created can give permissions and allow exploration which the client might avoid or deny in their everyday life. Jones informs that for the client in drama therapy, this would mainly involve the mimetic expressions produced by their own body, face and voice along with the use of space and interaction with others to play a role, but could also include the use of makeup, mask, costume, objects and props. Next technique is scripted role. In drama therapy, clients can use an existing text or create their own script to work from. These are worked with so that the client can find their own associations, meaning or interpretations. This might develop into improvisation or work on the text which further explore the association. The emphasis becomes less on the intentions of the therapist and much more upon the themes or meaning which the client feels to be significant. Jones notes that images, interactions, characters and reactions to the text can all be part of this. This helps participants to vent out their feelings and connect with different kinds of experiences. Another technique is improvisation role. According to Warren, through drama, individuals are not only being allowed to use their imaginations but can also be encouraged to enjoy using them. Through games, improvisations and theatre scripts, different roles can be taken. Frost tells that improvisation is an apt method for moment by moment awareness in the treatment setting. Lichtenstein states that improvisation is like free association. When doing an impromptu act without much planning, the participants spontaneously enact drawing from their own experiences, memories, beliefs, etc. naturally. This helps the clients in developing self-awareness and self-expression. Improvisation stresses the value of developing the capacity to move through the difficult and harsh moments sensitively. It encourages the capacity for reflectivity and creativity that are essential for navigating enactments, discretion around self-disclosure and other issues. Next technique is speech and storytelling. In this technique, the participants expresses his desire to tell the story of one's own life. Telling a story is an elegant way to distract from the reality and to activate the unconsciousness, which is full of meanings and resources. As per Folestina et al., for the therapeutic story, a suitable context is chosen which will present interest in the subject, and the problem elements are replaced with elements of the story, keeping the relationships between them. Such an expression leads to forming more positive and better coping life stories. This expression can be in the form of movement and expression in drama. Now we will discuss projective play technique. In projective play, the client uses the safety of the play space to express material and to represent it in a safe way. He or she may express aspects of his or her life which may feel overpowering. By using props, the clients can express his or her feeling on the external world in a manageable way. In addition to this, it becomes a way of beginning to tell his story in an indirect manner. Once the safety of the play space and the relationship with the therapist have been tested, this enables the clients to begin to tell more of their story to the therapist. It is usually used with children and adults with developmental difficulty. Projective play plays an important part in coping with their struggles and failures. Landy stresses that drama therapist facilitates the client's play with his style in order to help him or her discover a balance of affect and cognition. Next technique is acting out. In some cases, the drama therapist may ask the clients to reenact behaviors or situations that have caused problems in the past. It thus involves acting out negative behaviors in a safe space without facing consequences. This can be a difficult task to undertake as it can cause the client to remember and re-experience difficult emotions. They can act out their troublesome behaviors and they can look at their own behaviors and introspect on these behaviors. This can help them think about their behaviors. Patients may also act out some old experiences and resolve the conflicts around these earlier experiences. In drama therapy, people dealing with addiction can act out more negative behaviors in order to consider their harmful impact in a more tangible way. Nicholas notes that exploring issues in this way can offer a sense of distance so that their addiction and related issues do not overpower them. Now we will take another technique, that is masks. An important technique that is used in drama is use of mask. Masks helps the participant to enact feelings and emotions that one may not be able to act otherwise. Masks make them feel safer and more secure. It can help participants express and explore their conflicts, dilemmas, dreams, imagery, and social roles. The form of the mask affects the nature of the material projected by the client into the form. Hence, a blank mask will enable the client to project one kind of experience, whereas a mask of a clown might bring out a different kind. And a client's own decorated mask might bring out yet another. The creation of a second skin, as it were, means that the client can present a part of themselves through the mask. The presence of the mask creates a sense that this is not really themselves, but rather the mask that is speaking or moving. This enables the clients to project into the mask feelings or ways of behaving specifically to do with the part of them which is highlighted by the personality of the mask. The mask creates a freedom to express material that would be repressed within the client's usual presentation of their identity. Hence, the mask can enable a client to project aspects of themselves usually denied or hidden. The mask encourages a projection of a focused aspect of the client's personality or experience. The selective quality of the mask means that the one frame is presented rather than the continuous moving and shifting of the natural face. The effect of this is that one aspect or facet of the client is highlighted to the exclusion of others. This means that the client is invited to present a concentrated, heightened part of themselves. According to Jones, the mask then encourages a concentration upon a particular aspect of the self along with an emphasis on the expression of parts of the self usually denied expression. So, these are the techniques what drama therapy employs that gives it unique place in expressing hidden and troublesome emotions that otherwise remain untouched and have impact on the individual's life. We can say that drama therapy is not only concerned with the unearthing of primal pain and hidden strength. Drama therapy is also concerned with concrete behavioral manifestations of internal growth. Drama therapy is action oriented, aiming toward not only insight and emotional maturation, but also practical change and communication skills, interpersonal dynamics, and habitual responses are all actively examined in the drama therapy session. Change is not only envisioned but literally practiced. In sum, drama therapy is an active and creative form of psychotherapy that engages the person's strength and potentialities, accesses and embraces the person's buried woundedness and enables the practice and rehearsal of new life stances. The integrative framework for drama therapy is guided by these central concepts in humanistic psychotherapy, psychodynamic psychotherapy, and cognitive behavior therapy. To conclude, it can be said that drama therapy provides an opportunity to clients to express their inner feelings and anxiety in a safe space of mutual understanding among the group members along with the therapist. It helps in increasing emotional flexibility in the client and developing new skills in them. It thus contributes to enhanced self-esteem and well-being. So this is the end of this session. Thank you very much.